Your ACU-Track account contains 2 specialist pediatric pathways, which are specifically designed for monitoring outcomes in children and adolescent patients. These are the ACU-Track Pediatric Main Complaint Pathway and the ACU-Track Pediatric Additional Complaint Pathway. If you have specifically signed up as a pediatric clinic, the Pediatric Main Complaint Pathway will be your default pathway. Just like the adult pathways, the main and additional pediatric pathways are similar. However, you can only send intake forms and record clinical notes on the Pediatric Main Complaint Pathway. So if you are adding new patients manually, make sure they are assigned to the Pediatric Main Complaint Pathway to ensure that their initial patient intake form will be sent to them automatically by email. The Pediatric Main Complaint Pathway should be used to track a child or adolescent patient's main health complaint or issue. You can use the Pediatric Additional Complaint Pathway to track additional health complaints. The pediatric pathways contain a set of patient outcomes plans that are specifically designed for monitoring outcomes of children and adolescent patients. You will see these patient outcome plans in the drop-down button in each patient's clinical record underneath the pathway name. Once initiated, these plans will open a baseline questionnaire form immediately and automatically send all follow-up questionnaires to the patient by email at predefined time points of 2 weeks, 4 weeks, 8 weeks, 12 weeks, 6 months, 9 months, and 1 year. These plans make it as easy as possible for you to monitor your pediatric patient outcomes for a wide range of health complaints. For monitoring children's health outcomes, we use a parent proxy form, which means that the questionnaire asks the parent about their child's health status, rather than asking the child themselves. For monitoring adolescent health outcomes, our questionnaires ask the teenager directly about their health. These questionnaires are generally recommended for children between the ages of 6 and 12 and for teenagers between the ages of 13 and 17. However, the practitioner should always feel free to determine which plans are most suitable for any given pediatric patient. The Children's Health and Wellbeing Plan uses a general questionnaire to assess a child's overall physical health, mental health, and quality of life, including their social satisfaction, energy levels, sleep, and pain. We recommend you initiate this plan for all child patients. This plan uses a parent proxy form, which means that the questionnaire asks the patient about their child's health status. You can then initiate the cognitive function plan as well if the child has specific cognitive issues, such as ADD or other developmental issues. The Adolescent's Health and Wellbeing Plan uses a general questionnaire to assess a teenager's overall physical health, mental health, and quality of life, including their social satisfaction, energy levels, sleep, and pain. We recommend you use this plan for all adolescent patients. You can then also initiate additional plans to monitor a more specific health complaint or symptom, such as the Cognitive Function Plan, Mental Health Plan, or Pain Plan. The Cognitive Function Plan is designed to assess overall cognitive function, including concentration, attention span, and memory. This plan is ideal for monitoring specific cognitive issues, such as ADD or developmental issues. It is also suitable when a pediatric patient has clear symptoms of poor concentration, memory, or attention span difficulties. This plan can be used for both children and adolescents. It uses a parent proxy form, which means that the questionnaire asks the parent about their child or teenager's health status. We recommend that it is used in combination with the Health and Wellbeing Plan for both children and adolescents. The Mental Health Plan is ideal for monitoring adolescent patients presenting with any kind of psychological or mental health issues. It uses 2 brief questionnaires to assess key symptoms of anxiety and depression. The mental health plan can also be used when there is a clear element of anxiety or depression accompanying another health complaint. It can be initiated alongside the health and well-being plan. The pain plan is ideal for monitoring any type of pain. It includes a simple 0 to 10 pain question and is quick and easy to complete and can easily be initiated alongside other plans. All plans include a retrospective question in all follow-ups, patient's health complaint follow-up, which asks the patient how their health complaint has progressed overall compared to when they first started their course of treatments or care. It also asks the patient to provide any additional details about anything else in their lives that may also have affected how their health complaint has progressed. At 8 weeks, patients will also be sent a one-off additional follow-up questionnaire asking them how effective they felt their care was in addressing their health complaint, their overall satisfaction, any adverse effects they have experienced, and provides them an opportunity to give any additional feedback, which you can use as a testimonial.